Hello, I'm Zara Head and I'm the lead nurse for primary care quality here at Doncaster CCG. It's been absolutely fantastic to work together with our Doncaster general practice nurses to pull together the Doncaster general practice nurse development strategy. I'm delighted this will set the scene and the foundation to recruit, retain and future develop our fantastic primary care nursing workforce. I started as a general practice nurse in 2004, which feels like a lifetime away. Being a general practice nurse is the only nursing role where we care for whole families, from tiny babies right up to end-of-life care, all the long-term condition management and all the bits that happen in between. And it could be the same family, so we know that whole community and we work with our patients on such a personal level that we can give really individualised care and support and advice. In general practice nursing, no 2 days are the same. We work with multidisciplinary teams, we share knowledge and experience, and it's the variety of the role that I absolutely love. And I think one of the things that people don't generally think about with general practice nursing is that the future role and career development are endless. Long-term condition management specialist nursing, the nurse management roles, quality and assurance, commissioning, it's endless. It's such a varied path and it's such a fantastic career.
Hello, my name is Ben Scott. I am the Clinical Director for Doncaster South PCN, but I'm also an Advanced Nurse Practitioner at Conisbrough Group Practice. I think GPNs, or primary care nursing, is a fundamental part of primary care in its entirety. We are a group of individuals that have a diverse skill set. We're all good at our own each different things. I came into nursing quite late. I came in at 25 years old after, having a bit of a funky event in my life that led me down this path of nursing. Trained at Sheffield Hallam University, had some fantastic placements, so both in Doncaster and Sheffield. And then an opportunity arose for a job in Dennerby as a ANP, because at the time I was a trainee ANP at Mid York. So I felt like that it felt like the right move to do. I've always been a real fan of engaging with communities, and I see that that's a fundamental part of what we do in primary care. At Conisbrough, they'll probably say it feels like forever. I think it's only been about just over 2 years, I think. So it's developed from, I think, an inner passion of wanting to make a difference to people just in their entirety, and again, a lot bigger than health. So I've actively moved to places where I think it would give me the most diverse set of skills. And then you'd start to become a more autonomous practitioner when you go down ANP route, which is what I always wanted to be. I always wanted to give and do more, or do as much as I can to wherever it would take me. And then, come into an ANP, and then even further, more recently, into the clinical director role, which has been a real steep learning curve over the last 6 months, but been amazing at the same time, really. And feel very privileged that I'm only one of 16 in country that are in this role as a nurse. So a career in primary care nursing is not just for the end of your career, and that's changed now. That is the opportunities, the diversity, the extended skills, the places that you're working as well now. Everything seems to be moving. So I'd wholeheartedly recommend a career in primary care nursing, but then I would wholeheartedly recommend a career in nursing, full stop. So it's whatever fits for that individual, but it's for everybody. It's for newly qualified up to nurses that are ready to finish their careers.